Okay, we're going to talk about the conduction system next. I'm going to warn you that if you haven't really kind of mastered the anatomy or the blood flow, you might want to pause before you go through this recording because I feel like you have to really be able to understand the blood flow before this is going to make sense. Because normally I do this lecture kind of all together, but because of like the COVID curriculum and how I'm trying to restructuring it, I've broken them into smaller pieces. So you kind of have to know one piece before you move on to the next one. So we're just going to talk simply about a small portion of the conduction system, and we're going to keep adding pieces and until you guys can see the whole picture. I'm also going to try to utilize some different diagrams to help make that picture more clear for you guys. So for the conduction system, we're going to be looking at kind of like the electrical impulses of the heart here. So in the anatomy PowerPoint, the first one that you guys did, we talked about the different layers of the heart. We mentioned the epicardium, myocardium, and endocardium. So for the myocardial tissue, which is really the bulk of what the heart is made up of, there's 4 properties that I really want you guys to kind of hone in on. So this is a really good flashcard material. This is fair game for the exam, is knowing these 4 components. So the first thing is that myocardial tissue has cells that are very excitable. And what that means is they respond very easily to electrical, chemical, and mechanical stimulus. You want these type of cells in the heart because when you think about initiating a heartbeat and the electrical impulses involved in the contraction of the heart to allow it to be an effective pump, you want to make sure that those signals can spread quickly, efficiently. You don't want any barriers to that. You want that to happen very, very quickly. Just a little thing that I want to note here, because we talk about it in the next unit, is that people who have electrolyte imbalances, so examples of electrolytes are like sodium and potassium and bicarbonate. If you start to get really abnormal electrolyte levels, that can very much impact your heart. So you can see cardiac arrhythmias and different things like that if you start to have electrolyte imbalances. So one of the things is somebody comes in and they have labs done and we look at their electrolytes. If we are very concerned that they're off the normal range, we'll try to correct that quickly because it can be very problematic for their heart rate. Okay, I'm going to get it together and focus. Here we go. The second property that we're going to talk about is automaticity. So this is kind of the fact that the heart initiates these spontaneous electrical impulses, specifically with the sinoatrial node or the SA node and the atrioventricular node or AV node. And we're going to look at these on a diagram here in a second. But these are considered the pacemakers of the heart. And if you think about what a pacemaker is it's what's initiating that heartbeat and keeping it going no matter what. It's an autonomic system that happens. It starts kind of independently of anything else. And these are considered kind of the starting point or the initiation of your heartbeat. Conductivity is the next property we're going to talk about. So myocardial tissue is able to spread and conduct electrical impulses, and it allows for contraction without direct innervation. And what that means is, when you're talking about direct innervation, is you can think about the fact that most impulses spread through a nerve fiber, and it has to connect to a very specific cell or a neurotransmitter. There has to be a direct path. Myocardial tissue in general has conductivity. So you could almost think of it as like if you had a power cord that had been placed into a puddle, like that water is going to conduct that electricity and spread it. It's the same way with your myocardial tissue. You don't necessarily have to have a direct nerve connection, or that's kind of that innervation, a direct nerve connection for that impulse to get where it's going. The myocardial tissue in general is a great conductor. The fourth property that we're going to talk about quickly here is contractility. So the primary function of this myocardium is to contract in response to an electrical impulse. So we're going to talk about why the contraction of the heart is important when we get into hemodynamics. Like I said, I know it can be sometimes frustrating to have little pieces of the puzzle, but I'm trying to keep these lectures short, so just bear with me. So contractility is very important with the heart. When it contracts, that's how it pushes blood out. So the myocardial tissue has the ability to contract very easily and very quickly after an electrical impulse. And then it goes into what's known as a refractory period. So it contracts, and then it relaxes. And that refractory period is considered its relaxation period. And we'll talk about that in another part of this puzzle that we're putting together. But essentially, just for your guys' benefit, if the heart is contracting, that's considered systole. If the heart is relaxing in this refractory period, that's considered diastole. So just kind of defining terms as we go here. If it's contracting, it's systole. If it's relaxing, it's diastole. And we're going to look at that in more detail as we move through different PowerPoints here. But anyway, it's able to contract down. That's the last property of the myocardial tissue. Okay, so this is just another slide where I break it down. And again, if I break things down more than once, please believe me that this is something you're going to want to put on a flashcard. I would not lie. Okay, just really quick defining terms before we move into the second part of this. If you're talking about to depolarize, you're talking about to contract. If you're talking about to repolarize, you're talking about relaxing. So just memorize these, because when we're talking about the electrical conduction system of the heart, these are words that I'm going to use. When we're talking about EKGs, these are words that I'm going to use. So just very simply, depolarizing is contracting, repolarizing is relaxing. So this is the anatomy that you guys are going to be responsible for. This diagram is something that you guys should memorize. So there's not a ton of new information out of the anatomy. A lot of this should look familiar. You have your right atrium, you have your tricuspid valve, your AV valve here. Down here you have your right ventricle, right? Left ventricle, left atrium. This is your aortic artery, your aortic arch here, your superior and inferior vena cava. What they're adding here in the yellow is the conduction system. So we talked about the SA node and the atrioventricular node here being the pacemakers of the heart. So here's your SA node. It's going to fire kind of independently and start off this heartbeat. That's going to fire to your AV node, which is then going to send a signal to what's called the bundle of His, and that's located right here in this myocardial tissue. That is going to send an electrical signal down through the left bundle branch and the right bundle branch, and that's going to continue on through the Purkinje fibers up through your ventricles, and that's what's going to cause your contraction or your depolarization. And I write this out in more detail later on in the lecture, so just know that this is all in one place, written in detail, and we'll go over it. But for right now, this is the general order of things, and this is what the anatomy looks like for that. So again, SA node fires, it's the pacemaker of the heart. It's going to go to the atrioventricular node. That's going to go to the bundle of His, down the left bundle branch, down the right bundle branch, up through the Purkinje fibers, and we will talk about all those steps in detail moving forward, but that's the general anatomy. How we look at this electrical conductivity of the heart is through something called an EKG, or you can also hear it called an ECG, and it's an electrocardiogram. A lot of people are familiar with these. There's a lot of complexity with these printouts, and they can look at all kinds of parts of the heart. For us, for this unit, we're just looking at the P wave, the Qrs complex, and the T wave. So your P wave is your atrial depolarization. And again, to depolarize is to contract. So the P wave is looking at the atria contraction. And then your Qrs complex is looking at your ventricular depolarization or your ventricular contraction. And then your T wave is looking at your ventricular repolarization or your ventricular relaxation. So there's a couple things that I just want to circle in here, okay? Again, depolarizing is to contract, repolarize is to relax. Systole, contraction. Diastole, relaxation. So if we're talking about atrial depolarization, we are talking about the atria contracting. So if you think back to your anatomy, your atria are the right and left little cups on the top of the heart, on the base of the heart, that fill up with blood when the heart is relaxed, and when they start to contract, With depolarization, that's when they're going to start sending that blood flow forward, and we're going to talk about that. But just for right now, really hone in on these definitions and know that the P wave is atrial depolarization, the QRS complex is ventricular depolarization, and the T wave is ventricular repolarization. You can look at these definitions, get them down, and then when you're looking through the whole cardiac cycle, which we are going to talk about, this will make more sense. So for right now, it's just kind of chunking it up into terms, and you'll get the bigger picture in a little bit here. So if you're kind of following this heart cycle here, okay, we know that the blood flows from the atria into the ventricles. So here you have a heart, and you can see this electrical signal in the purple is starting. So imagine that these atria on both sides have filled with blood. So your right atrium is filling from your superior and inferior vena cava with that deoxygenated blood from your body. At the same time, your left atrium is filling with oxygenated blood that is coming back through your pulmonary veins, right? So that's happening at the same time. Your right and left side of your heart are filling, one with deoxygenated blood and one with oxygenated blood. So this is happening when the heart is relaxed during diastole. When those are full and it's time to start systole and it's time to start this electrical signal, this heartbeat, what's going to happen is you see this electrical signal start in purple up here, and these atria are going to depolarize. They're going to contract, and you can see this happening. They're getting smaller and they're contracting. And when they do that, what they're going to do is push blood from the atria into the ventricles. And you can see these AV valves are open. They're pushing that blood from the atria into the ventricles through that atrial contraction. That's also your P wave, all right? So now imagine that the blood is in your ventricles, and they don't show it on here, but your blood is in your left and right ventricles. And that signal is moving its way down from the AV node to the bundle of His, and then now it's going down the right and left bundle branch. So you can see that purple is down here, and it's starting to contract the ventricles. And that's that QRS, and it's actually a complex, not a wave, QRS complex. So you can see this electrical signal coming down in purple. It's starting to contract that ventricle. That contraction is moving down that interventricular septum and then up the sides to really contract those ventricles down. And you can see it spreading until those ventricles are very contracted down. And the reason why you want the ventricles to contract is they are going to contract down and push blood out. So your right ventricle is going to push blood through your pulmonary artery into your lungs, and your left ventricle is going to push blood through your aortic artery out to your body. And we're going to look at that again, guys. This is not the only time I'm going to go through this, I swear. I'll have a diagram where all of the things are in one place, and we're going to talk it through. So this is your QRS complex. And then after your ventricles have contracted and ejected the blood either into the lungs or into the body, depending on if it's the right ventricle or the left ventricle, they have that refractory period where they're going to start to relax again, because now your heart wants to refill. It has to go back to its resting condition so it can refill with blood, okay? So your heart is now relaxing. It is repolarizing. This is also known as diastole, and this is where you're going to look at the T wave, and you're going to start all the way back to the beginning. And this is almost like you could consider the filling side of the heart, because your heart contracts for a beat to eject blood out, but your heart also has to relax to fill. So your diastole is your relaxation or your repolarization, and it's when it fills. So that's the way that electrical conductivity works, and that really is to the level that you guys have to understand it right now. Later on in the program, near the very, very end, you guys do a cardiac diagnostics class where you really look at the details surrounding some of the things that can go wrong with cardiac arrhythmias and blocks and all kinds of things. And you guys get very detailed with your EKG interpretations. But for right now, we're just doing like the basic signal spread. So this is the level that you have to know it. And like I said, I will put together a diagram where all of this is in one place and you guys can see it again. The other thing I want to show you here is Starling Law. There's not a lot that I'm going to do with this at all, but I wanted to include it on this particular PowerPoint because I do believe it's still a board question, and all it is the greater a cardiac fiber is stretched to a point, the greater the contraction it will have. And this comes into account if you're thinking of the heart filling. As it's filling and it's taking on the blood volume from your body, as it's filling up, it's stretching. And myocardial tissue is designed essentially because of myosin filaments and all kinds of stuff that we don't have to understand because we're not doing biochemistry. But as the heart fills and it takes on that large volume of blood and it stretches, it makes that myocardial tissue want to contract back into its original position. So the more it stretches, the greater the force of contraction it's going to have. And that's considered the Frank-Starling law. So your cardiac output, which is your stroke volume times your heart rate, will increase in proportion to the diastolic stretch of the heart muscle fibers. And all that means is during diastole, when your heart is relaxed and it's filling up with blood and it's stretching that tissue, the more that fills, the greater of a contraction you're going to have. And we're going to talk about this in detail in hemodynamics, but for right now, for the Frank-Starling law, the more stretch that you have, the more contraction you have. And that's all you really need to know about that. These are your lecture questions. That's it for this one. And like I said, I know it's probably slightly frustrating that you guys are getting this in pieces, but that's part of me breaking it down, and it just kind of is what it is. So I feel like it's going to come together in the end for you.